Welcome back to Girl Talk. We're filming today at Bella Domicile. We've got a lot of great topics to cover. One of those, however, with the holiday coming up, is Halloween candy. I know
Gets you every year.
Doesn't it? Especially with the kiddos. Sometimes it's tough.
It's hard to resist.
It's an important topic that Janet actually caught up with Dr. Angela Cotey at Village Smile Care recently, so we're going to check in with her and get that report.
Well, I'm all brushed, flossed, and took a drive out to Mount Horeb to Village Smile Care to talk about how to keep our smiles looking super bright. With me, I have Dr. Angela Cotey, our Girl Talk dental expert. Thanks for taking a few minutes to talk about keeping our smiles healthy. Let's talk about specifically cavities today, and I'm wondering, how does it work? How does sugar actually cause cavities?
Yeah, well, Halloween's just around the corner, so it's a common question we get. And sugar actually, it's not necessarily the sugar itself, but it's very easily broken down by the bacteria in our mouth. And that bacteria causes an acidic environment, which breaks down the tooth enamel. The enamel is the strong outer shell that causes a hole in the tooth, which is a cavity. So it's more the sugar allows the acid or creates the acidic environment for the bacteria to break down the teeth.
Sugar makes for happy bacteria.
Yeah, for sure.
Okay. And so what are some of the factors that lead to the decay?
So sugar and bacteria are needed, which we have tons of bacteria just naturally in our mouth. The really important factor is time. So the amount of time the sugar is on the teeth and the frequency. So having sugar throughout the day can cause more cavities. Basically, anytime you have sugar in your mouth, it's about 20 minutes of an acid attack on your teeth.
Say that one more time.
So if you eat something sugary for about 20 minutes after that, that acid attack is happening on your teeth.
Okay. You know, it seems like I know some people that have a very sugary diet, and it seems like they never get cavities. Is it true that people have maybe different susceptibility to it?
Yeah, there are genetic factors, and everyone has different enamel strength. So, you know, depending on the fluoride content of the water where you grew up, things like that, some people have stronger or weaker enamel, and so some people are more susceptible, so some people can get away with a little more. But over time, anyone who's susceptible to those things will probably get a cavity at some point.
Even with really great dental care?
Yeah.
Oh, that's so not fair.
Yeah.
So does that mean we should be looking for maybe soft drinks or foods that are sugar-free?
That's a great idea, and it is very helpful to try to avoid high sugar content food and drink and find things that are sugar-free. However, you still have to be careful. A lot of things that are, you know, sugar-free and healthy maybe still have acid in them. So I have a chart of different, the acid and sugar content of different beverages especially. So basically, you know, something that might be considered healthy, like tonic water, they add carbonic acid to carbonate it, and so the pH of that is 2.5. So to give you a range, the pH of our body, or a neutral pH or tap water, is about 7, and battery acid is about 1. So that 2.5 is much closer to the battery acid. So that carbonic acid is really or that tonic water is really still harmful to the teeth. Diet soda, for example, has a pH of about 3. Even like fitness waters, where they add flavoring, like a grape water, like Propel, that can have a pH of about 3.4. So those are all still going to break down the tooth enamel, even though they're considered maybe sugar-free. So I've highlighted the ones that are sugar-free but still acidic. So even with drinks that are sugar-free, you need to be very careful.
Okay, I'm already feeling guilty about what I've been drinking today. I actually have a Propel in my bag right now.
They're very popular and people think it's healthy, and you know, it's still a better choice, but you still just have to be careful.
I guess so. How can we be careful if we still want to enjoy those things?
Well, we talked a lot about the time thing. So you've probably maybe heard the term sip all day, get decay. So if you're sipping them throughout the day, that's going to have more instances of them on your teeth. And so if you can at least have your sugary snacks and drinks with a meal and then brush after or rinse with water, that's really going to help. So just eliminating or minimizing the amount of time those are on your teeth will be helpful.
Okay.
Everything's okay in moderation, right?
And before we leave, any other tips you want to share today?
Just proper oral hygiene, like brushing and flossing. Like I said, rinsing with water if you can't brush. And if you know you're susceptible or you tend to get cavities, adding some extra fluoride. There's some over-the-counter rinses such as ACT, just ACT, or your dentist can prescribe a prescription stronger fluoride rinse.
Alrighty, all good tips. Thank you so much. I'm so bummed about the Propel. Alrighty, this is Dr. Angela Cotey. She's at Village Smile Care in Mount Horeb. We have more Girl Talk for you right after the break.